Welcome to today's webinar, The Effect of Consumerism on Healthcare Payments. My name is Emma Goodman, and I'm thrilled to kick off today's discussion. We thank you for joining us, and we hope that you are staying safe. Today's webinar will be a panel-style presentation featuring two experts within the dental industry. We should have time at the end of the panel for audience Q&A, and you can submit any questions you have throughout the program by typing them into the Q&A box you see on your event console. This event is also going to be recorded, so you can view this on-demand webinar at any time using the link that you logged in with today. At this time, I am so excited to introduce our terrific panelists. We are joined by Mike Peluso. He's the Chief Technology Officer with Rectangle Health, as well as Richard Huot, who's the Chief Executive Officer for Beachside Dental Consultants, Inc. I would be remiss to say that we are missing two lovely panelists today, Mike and Virginia, who are not able to join us live, but we're excited to engage them in future content and bring that to you guys here in the future. So with that, I am pleased to turn the floor over to our terrific moderator, Scott Becker, the publisher of Becker's Healthcare, to begin today's discussion. Scott.
Fantastic, and thank you very, very much. We're going to again talk today about consumerism in healthcare. We have Mike Peluso from Rectangle Health, Richard Hewitt from Beachside Dental Consultants. The focus will be on healthcare generally and dental more specifically. Mike and Richard, let me take a moment to ask each of you to introduce yourself. Mike, can I get you to start?
Sure. Good afternoon, everyone. Mike Peluso. I am the Chief Technology Officer for Rectangle Health. Rectangle Health is a company that focuses on healthcare, medical, dental patient payments. My experience specifically is with taking dental technology or taking payment technology and bringing it to the dental healthcare markets. I've been doing that for the past 10 years for Rectangle Health. Prior to that, I spent a significant amount of time working with Zirmed on their application for the medical dental industry around bringing payment technology to that industry. And for quite a few years before that, I actually worked in a hospital collections department. So I've done a lot of the things that the folks on the phone are listening about. I've actually applied the practices that we're going to talk about today.
Fantastic. Mike, thank you very much. Richard, let me ask you to introduce yourself. And I'll also ask each of Mike and Richard, if you can, if you're talking on a speakerphone, to pick up the phone if you don't mind. Richard?
Great. It's greetings from sunny Florida. I'm glad to be here with you all. And I've been a dentist, clinical dentist for 38 years and a private practice owner for 25 of those 38 years. I started my consulting company back in 2004. So for the last 15 years, I've been doing in-house consulting for private, public, and government entities. And the list of services that I provide for consulting you can find on my website at militarydentist.com. And I'm happy to be here to answer any of your questions.
No, and Mike and Richard, thank you so much for joining us. Mike, I'll start with you. Consumerism in the dental practice. What are some of the things you're seeing and how consumerism is affecting the dental practice?
Sure. And before we even talk about the dental practice, I'll try and give sort of an example of consumerism, or at least how I think of consumerism. If we were to think about a video store 10, 15 years ago, I'm sure a lot of the folks on the line remember a traditional video store where you walk into the video store and there's a new release section and there's a kids section, but it's generally laid out how the video store wanted to lay it out. If we were to think of an example today, we all use Netflix or some sort of on-demand type service. When we log into those services, everything is generally served up based on us, the consumer. It's not laid out the way the video store needs it laid out. It's laid out the way I want it laid out as the consumer. If we take the same principle and sort of convert it over to a dental practice, years and years ago, we kind of, when we made an appointment with a dental practice, it was based on that schedule. When we made a payment with a dental practice, and that's my area of expertise, we got a paper statement in the mail and we sent in a check. And sometimes that was 30, 40, 50 days after the fact. So as we think of the consumerism for a dental practice, it's really trying to create that more patient experience, that more consumerism experience. We could think of other new age companies like Uber or Amazon, where it's really designed for the consumer to utilize the services, to pay for the services, to consume. In a dental practice, it's really the same thing for a patient, for the patient to be able to easily make an appointment, for the patient to be able to easily make a payment, for the patient to be able to utilize tools that are generally accepted in the consumer industry within a dental practice. And those tools could be, like I said, online appointments, or they could be payment tools, things like card on file, recurring payment plans, anything along those lines that really makes that patient experience or that consumer experience a little easier at the dental practice. So that's how I see consumerism in the dental practice today.
Thank you very, very much. And it is quite an evolution, because it's still a situation where you go to the dentist and often you're paying by hand to the person with your HSA or your credit card, or you're trying to make your next appointment and trying to fit in their schedule for the right person, and so forth and so on. Richard, let me ask you the same question. What are you seeing in terms of consumerism in dental practices? And then I'm going to ask you the following question: is what types of practices is consumerism becoming more prevalent? But start with, what are you seeing in terms of consumerism?
Hey, so Mike did a great job of explaining the progression of how dental practices have evolved, especially when it comes to payment terms and custom service. And interestingly enough, depending on where you are in this country or what the type of consumers are seeking dental care, you have different types of practices, and that can vary when it comes to different demographics, people seeking dental care, also different regions of the country. You'll have a more rural setting or a more city setting, and depending on the consumer and how they are apt to have other transactions in their life done, then they are more likely to seek a dentist that has those types of payment plans or types of consumer items, at their practice.
And are there different types of practices where consumerism is more prevalent? And Rich, let me start there with you. I mean, what's your sense of that?
There's definitely different consumers, and you can break it out into demographic groups. There's no question that we're seeing already that millennials and Zs will purchase dental care in a different manner than, let's say, your baby boomers or your traditionalists. There's, I saw it in my practices, and I saw a progression of that as I went through different practices, and you could see based on the age groups that you had in your practice, different types of age groups wanted different types of services, and they expect it, and they will stay with you if you offer those types of services.
And Mike, let me ask you the similar question. Richard's explained that you have different consumerism based on different demographics and age groups and other types of things, and so true. What about different types of practice in terms of modalities? For example, a general dentist versus the implant,
Sure.
provider, oral surgery. Is there different senses of consumerism more rampant in moving along quicker in some areas versus others?
Sure. And I think the consumerism scales with the consumer, Scott, meaning, sort of cosmetic dentistry. You're going to see a much bigger consumerism effect. You're going to see a lot of payment plans. You're going to see a lot of interaction around getting that payment up front. And really it's on both sides. It's on the patient side, and that the patient wants more of that consumerism effect. It's also on the provider side, the dental provider side, where they want to get paid. Again, this is an elective type world. This is a cosmetic type world. Backing down to general dentistry, or even if you were to think of emergency dentistry, the consumerism effect is not as prevalent. It's there. It's definitely there. And obviously everybody wants to get paid for services they deliver. And I think patients want to pay for the services they deliver, but it's not as prevalent in those types of practices. I think over the last few months, definitely with COVID coming on, though, it has grown even in general dentistry and it has grown even in emergency dentistry, where we really want to give that patient a way to engage with the office, whether it be from a payment perspective, whether it be from a communication perspective. It really starts to sort of flow down. So kind of sum it up, up in elective and cosmetic dentistry, I think that consumer effect has been there and continues to grow and continues to be more important. But over the past few months, I think it's really started to penetrate into general dentistry, or even as we think of emergency type dentistry, or the necessary dentistry.
And let me ask you this follow-up question, and then I'll move back to Richard in a second. For dentists that are trying to manage consumerism and trying to manage how their patients work with consumerism, how does this affect them? What do they need to do?
They really need to take that approach of, and again, if you go back to my video store example, they need to take that approach that the patient needs to be engaged. The patient needs to be part of the process. It can't be have an office on Main Street and hope that patients come in for services. It has to be engaging that patient about their appointment, engaging that patient about your services. And then really, once you're delivering those services, or as you're about to deliver those services, get a text out to the patient about payment. Maybe, and depending on the demographics that we talked about, maybe get a card on file from that patient prior to care, so that the experience of when the patient comes into the office is again, that consumer type experience. When I go on to Netflix, I don't really worry about my credit card. I don't really worry about my payment. What I do is I just start clicking on movies to watch movies. My wife does the same thing when she goes on Amazon. She just starts clicking on stuff to purchase stuff, and she's consuming what Amazon is selling. But what Amazon has done, and what dental practices can do, is really take that payment piece and carve it out, make it so that it almost doesn't exist. It's happening. Again, we all pay for that stuff we get on Amazon, but as we click on it and get it delivered, it's kind of carved out. So dental practices can really leverage technology and really engage consumers on that level.
And Richard, similar question. Where do you see dentists doing this well, and what do they need to do to manage this effort well, this kind of transition? I mean, Mike talks about how easy it is on Netflix, Amazon, all these services to engage digitally. What do dentists have to do to sort of manage this effort and improve this effort, dentists and practices?
So I think like companies like Amazon and Netflix, what they've done is they've done a one-stop, one-shop patient experience. And I think that's where dentists have improved, because, for instance, I would say less than 20 years ago, probably 10% of general dentists were placing implants. That has changed now. I would say that it's probably only 10% that don't do that. But the ones that still don't do that have allied themselves with either a periodontist, oral surgeon, or a type of surgeon, or maybe general dentists within a group, that all those procedures are done in one place. The consumers are demanding that. They want to go to one place, they're familiar with it, and whether it's because of time, familiarity, or convenience, you see a lot of that now. So most general dentists have had to really step up their game when it comes to that, and allied themselves either with a really good referring group of specialists, or have brought in general dentists or specialists in their own practices, so that all those services can be met in one place.
Does the movement towards consumerism, can it help dentists get paid better for treatment? Is that a part of this, a big part of this? And can it be helpful to improving that? Mike, do you want to take the lead there, then I'll turn to Richard on that?
Yeah, absolutely. And it goes a little bit to Richard's comment before around the demographics. Various dentists are going to have various demographics. Various dental groups are going to have various demographics. And it's really about any way that demographic wants to engage or pay for services, the office should really look to deliver. So you could get a Medicare type demographic that traditionally wants to pay at the point of care. We want to enable that type of payment at the point of care. And we want to make it as frictionless and as seamless as possible. So obviously credit card, HSA, FSA will really enable that at the point of care. The ability for the patient to be able to do it similar to the way they do it at a Home Depot or a Walgreens, where there's a device, the patient can interact with that device, the patient could even sign their HIPAA forms on that type of device. So there's that point of care payment. When you think of a different demographic, and we'll use myself, for instance, I'm sort of an online payment guy. So I pay via the provider's website. So a lot of times when I go and I look at a dental provider, I immediately see, can I pay them online? That's important to me. I still get the paper statement, believe it or not, traditionally. But once I get that paper statement, I go online and make a payment. Today, there's a demographic, we all know them. There's probably a few on the line, the millennials of the world. They're a lot more like that Amazon or Netflix effect where they, before they even get to the office, they want to leave their card on file. That way there, when they get to the office, their experience is really all about getting the dental treatment. The card is on file, the insurance information is possibly captured digitally through an application. And when that patient comes into the office, they're going to the operatory, they're getting whatever they may need, and they're leaving. Think of it a lot like the Uber, which I mentioned before. Whenever an Uber car comes and picks one of us up, it takes us wherever we need to go, and we get out. And it can do that because we left the card on file. That demographic that exists today, that millennial demographic, really pushes for that type of interaction. And really, if a practice can leverage all three of those, or leverage the one that focuses the best on their demographic, they're guaranteed to increase their payments.
Mike, you mentioned the paper payment, and I'll make an admission in front of everybody that sometimes I throw out the paper payment. So certainly this process would probably help the dental practice get paid much more quickly, and agreed. Thank you for your comments. Richard, your thoughts. When you see these technologies invoked and so forth, Mike hits this really well about how this, if done right, can reduce friction, improve payment, avoid the person who's a bad consumer and throws out the paper bill until he gets called and called a couple times. What's your sense of this? Are these technologies starting to help people get paid better? What are you seeing out there?
Yeah. So I'm going to take Mike's concept about card on file, and I'm going to use insurance payments. So most of your consumers today, if they have dental insurance, what they want to do is they want the office to file the insurance payment for them efficiently. And if the insurance pays a certain portion of it, they just want to be responsible for the co-pays, deductibles, or anything else that's not covered by their insurance. Now, most of your softwares now have responded to that very well. And what Mike's concept about the card on file is all those parts that are not covered will go immediately to the card, and avoiding a paper trail or whatever can easily be done by having a dental software that would just email a receipt. It's when I go to Staples and I get office supplies, they ask me if I want to print or if I want an email receipt. And depending on the mood of the day, I may get both. So either way, the patient consumer is satisfied. Their out-of-pocket expenses are minimized, and everything is seamless as far as the office and the administration of the payment.
And you've hit it really right on one thing you said, and everything you've said, but particularly this issue, it depends on the mood of the day, whether you want the print receipt or the email receipt or neither or both. It depends what you're buying, et cetera, and so on. Talk about for a second, Richard, how the implementation of these consumer-friendly payment and engagement options can make life easier for dental practices and patients. How can this make it easier for the practice?
Well, I think what it makes it a practice is that the objections about payment, the objections about treatment are not confused with the payment method. When you make a seamless payment method, whether it's private, whether it's a third party that's paying for it, you have a much higher percentage of people accepting treatment. And Mike touched on it previously. When it comes to, let's say, a cosmetic procedure, most patients know that their insurance companies won't pay for that. So you have to make sure that the patient completely understands what they're responsible for as far as cost, and it's done, the payment terms and conditions are all taken care of before the patient leaves the office.
And Mike, let me ask you the same question. how when this is working right, when your firm's working with it, or it's working right with your firm or otherwise, does this make this easier for practices and patients? How do consumer-friendly payment options make this easier?
Sure. And we'll take it from two sides. We'll take it from the patient side and the practice side. But first is the patient side. And Scott, there's nothing that's going to make a root canal less painful. I've never had one, but I hear they're quite painful. So there's nothing that's going to change that experience for the patient in that a root canal is painful. But what we can do is these payment tools or these consumer engagement tools that we're talking about, or this whole idea of consumerism, is we want to make everything else easier for the patient. Like Richard said, we want to make it easier to bill their insurance. We want to make it easier to identify the balance due from their insurance. We want to make it easy for them to have that balance due hit a card on file automatically so no paper shows up. And if I send you a paper statement and remind you of your root canal, Scott, you're probably going to throw that paper statement away just to forget about the root canal. But if we can really make that whole experience easier, we can make it easier for everyone to just have a better experience at their dental provider. And again, these are the consumerism tools. Netflix makes it easier for me to watch videos whenever I want. We want to make it easier for that patient to get that root canal, get the pain over with, get the pain around it, whether it be the insurance payment, whether it be the patient payment, get that out of the way. Maybe they don't have dental insurance and they have $1,000 balance. We want to get the pain of paying that $1,000 out of the way. Can we put them on a recurring payment plan? Can we send them a text so that they can pay via text? So even if they're paying at the point of care, we don't want to have them wait around after they got that root canal. They want to go home and they want to rest. Can we send them a text so that they can pay at a later point in time? If we think of all these tools, they're really designed to give that patient a better experience. Again, nothing's going to make a root canal less painful, but this will make the overall experience with an office less painful. And then on the provider side, so for the provider, these types of tools also should make things less painful for them. There should be a lot less paper bills. There should be a lot less trying to track down the patient. Again, you have a mobile phone number, you could send them a text. Text messages have a 99% open rate, meaning when any of us get a text on our phone, we always open it and we always read it. Unlike the paper statement that you throw away that nobody reads, text message have a very high open rate. So it makes things a lot easier, not just for the patients, as I mentioned, but a lot easier for the practice.
And Mike, let me ask you a follow-up question. I'm going to ask you one or two questions from the audience that we've got so far. We've got a number of them. Then I'm going to ask you a couple questions I planned to ask you already. First, are you seeing more point-of-sale financing, point-of-care financing, prepayment discounts, anything of those sorts as part of consumer friendliness, a consumerism approach?
Absolutely. The whole idea of card on file, again, when we can thank Netflix and we can thank Amazon and we can thank Uber for sort of blazing the trail in the retail world, the whole idea of card on file has really gained a lot of momentum in dental. I think and COVID has helped it out quite a bit in that, we don't want the patient to have to pay when they get there. If we can get their card on file ahead of time, it's really going to reduce that waiting room or someone standing in the waiting room making a payment. It reduces that if we can get card on file ahead of time. As far as the financing options, there's certainly the care credits of the world and those options. But really, I think what providers are trying to say to patients, and it's almost a customer satisfaction tool, but almost think of it as a marketing tool. Patient, we understand this stuff is really expensive. We understand you need this stuff, whether it be cosmetic and they want it, or it be something like a root canal and they need it. We can go ahead and take that $1,000 balance and break it up over time for your patient and make it easier. So Scott, it makes things easier for the patient, as we've been trying to say, and end consumerism. But it also can be a marketing tool to get more patients in the door, because now we're offering them financing, and it's not, you don't have to fill out paperwork. It's not a loan. It's a hey, I'm a dentist. I want to deliver this root canal to you. I understand it costs $1,000. You know what? I have this technology that will allow you to pay $100 a month for 10 months. And really, it says to the patient, hey, that this dentist is working with me. I'm going to go ahead and get that procedure done. So it really benefits that way as well.
And that $100 a month, it's much easier to stomach than $1,000 at one time for many people's budgets. Richard, I'm going to ask you this question, and it sort of plays into how technology is important and so forth, what role technology plays. But to take that a step further, why is it important to have a partner that he has great dental technology and has great dental expertise in looking at these payment solutions and so forth? When you're a consultant that's lived in the dental area forever, why is it important to have a good, someone who really knows dental and innovative dental technology?
So I'm going to respectfully disagree with Mike when it comes to root canals, because I can tell you that 99% of them are painless, but I think that he touched on it when it comes to the most critical part of the root canal is the painful part, is the payment part, which he has talked about on how to make that painless. I think you have to have all those critical technologies to make sure that the patient understands that for the dentist, the relationship is between the dentist and the patient, and the payment part is a part that's handled by another person in the office. And to make sure that the patient has to be satisfied that the doctor has their best intentions in mind and they get the procedure done. Now, when it comes to technology, the patient has to be comfortable and think that the technology that the doctor is using at the time is the latest, and the doctor is up to date on all types of procedures. And that goes a lot as far as taking the fair part out of everything that you do for any type of dental procedure.
Thank you very, very much. And Mike, the same question. Why do you need somebody who really knows dental technology, who really knows the industry, to help with these payment solutions, to help with this consumerism, this drive towards it?
Sure. I think one, technology, you want the most innovative technology. Historically, in the dental industry and even in the medical industry, which we work with, the legacy systems in these industries aren't designed to capture patient engagement or aren't designed to capture consumerism. They're really designed to capture clinical notes. They're also designed to sort of track some insurance payments. But when you think about engaging a patient and sending a patient a text message, or putting a patient on a payment plan that automatically runs $100 a month, or putting a card on file in a secure manner, these sort of legacy systems in the space aren't designed for that. So the newer systems, the newer technology, the companies that kind of almost took what Uber was doing and took what Amazon was doing and adjusted it for the dental market, that's really where you want to be. And that's really where you're going to create that smooth patient experience, that consumerism experience for the patient, and then have that system plug into the legacy system. I think that's really the key for someone in this space, is to really find a vendor that has the technology and then has the ability to take it and integrate it back to those legacy systems.
Thank you. And it's very much like buying a Peloton today or something like that. You'd be $1,800, but if you buy it through their Affirm payment system, their kind of system, you're paying $150, $200 a month for 10, 12 months. It doesn't feel nearly as bad, and they've made it so seamless and frictionless, and you're not scared to sign up for it, but you don't feel like your card's being stolen either. I mean, that's really
Correct.
what we're trying to do here, isn't it?
You got it. Yeah.
Fascinating. So talk to us a moment about, in the age of COVID, just even more so, why these consumer-friendly concepts are just even much more important. The seamless, the frictionless. Talk more about it in the COVID area.
Mm-hmm. And really, Scott, it goes to, again, you could do both sides of it. There's a provider side and a patient side. Like I mentioned in a previous question, the provider side is let's try and eliminate contact, and let's try to eliminate patients in the waiting room. If I can engage a patient to get their card on file up front, or I can engage a patient to get some demographic information, again, we don't want to have them sitting in the waiting room filling out the clipboard with a pen and piece of paper. If I can eliminate that and get that information up front, it obviously makes it the amount of work on my staff who are now worried about PPE and worried about getting the patient through the door, it reduces their work. From the patient side, again, these types of contactless type functionality, these types of engagement of the patient at home. Again, I can send a text to a patient to make a payment. I can send an email to a patient to make a payment. I can send a link to a patient to fill out their pre-arrival paperwork. This type of functionality has just grown tremendously over the last 6 months. Again, you hear terms like teledental and telehealth, and so that ability to really engage patients outside of the four walls of your office on payment specifically, really drives home that, hey, as a dental practice, we've addressed COVID, and here's some technology we have to make it easier for you, the patient. So it definitely has become sort of grown quite a bit over the last few months.
And Richard, as a follow-up to that, got an audience question that's a little outside the COVID era, but another area that's really of interest is, how do you combine some of these technologies and stay hyper-personal, hyper-close with your patients so they don't feel like they're being talked to by a bot, so you retain this patient relationship with the dental office and so forth? Any thoughts on some of those things?
Yeah, sure. I mean, so most patients already have a relationship with their dentist's office anyway. So the offices, because of COVID, the offices have become proactive and actually engage patients before they actually come in. So it's, for instance, I had my teeth cleaned during COVID, and, the office called the day before, and we went through the pre-screening questions that you need to ask before you get anybody into your chairs to make sure that nobody is displaying or exhibiting symptoms of COVID. So all that stuff is done ahead of time, and it goes along with what Mike was saying about, minimum downtime in the reception area. So if you take care of all this stuff before, and there are electronic ways of doing that, and what the patient is perceiving is that the office is a safe place to go to. So you're marrying technology with just sound medical practice, which is, you have to ask these questions, but you're using technology to help it and to make the patient experience better.
And Mike, let me transition back to you on another audience question. And again, your point is well taken, that this is all intended to make technology to make the experience better. And if it does that, it might not be the dentist calling the patient, but we lost that years ago. It might not have the receptionist calling the patient either, but we've lost a lot of that anyways. And if it makes the experience better overall, then it probably still works magnificently well and better for everybody. And I think, Richard, your point's well taken. Mike, let me ask you this question. And you've got this great experience in medical and in dental. Who's ahead in the consumerism area? Is dental ahead? Is medical ahead? Do you have a sense of that?
Yeah, so it's sort of interesting, and we'll go back sort of years and years and years ago. So at one point in time, you couldn't pay with a credit card at a dental provider or a medical provider. It was sort of a foreign concept for a lot of people. And I think dentists actually started the ability to pay via a credit card first. And again, it could have been because there's a lot more elective or a lot more cosmetic. And really, they ran with that for quite a few years. And then as sort of the copay started to increase, the coinsurance started to increase, the deductibles started to increase, medical all of a sudden said, wow, we really need to start doing something. FSAs, HSAs, credit card, payment at the time of service. And then sort of the hospitals kind of jumped on that bandwagon, and the large health systems really started to jump on it. And in the medical world, there is a lot of sort of adoption of these newer technologies. I'll definitely say dental was the first to start taking credit card, but medical is the one that is now adopting these technologies, texting patients, giving patients online portals to schedule appointments, giving patient online portals to see results, giving patients online portals to see x-rays. Dental is starting to adopt some of the technology, and really, it's hard to adopt it all, especially for smaller dental practices where you have a sole proprietor, or it's hard to adopt this much technology all at once. But there are certain pieces that dental providers can definitely tip their toes in. So Scott, I think medical is pulling ahead and leveraging a lot of the technology that we talked about and a lot of that consumer engagement. But dental's close behind.
Your points are fantastic on it. I mean, a lot of dental was self-pay for a very long time. So early on got ahead of it. At least a lot of it was self-pay. As practices and hospitals became much more dependent upon the copays and just become a write-up became a very important part of the payment stream, hospitals also caught up. And then you've seen this huge consolidation of hospitals and health systems. And while there's been consolidation in practices and dental practices, it's not quite nearly what it's been in the hospitals and health systems. And then you've got these massive resources that can move forward on some of these technology things. And for small practices, a little bit harder, both economically and just having the staff to deal with it. And that's where having a great partner like yourself comes in for small and mid-sized practices as well as large practices, because you can make this happen even in a relatively smaller setting and make it work. Another question that we have from the audience, and Richard, let me pass this to you. Our practices, not so much practices, but patients still very concerned about card on file, leaving their card on file. How do patients feel about that? What's your sense on a dental practice? How well is that being adopted?
I think a lot of that, as far as card on file concerns, it's kind of interesting because we've been laggards, we as in the medical and dental professions, as opposed to it's standard practice in many other professions. I mean, when you make a reservation for a hotel or motel, they block off a certain amount off your credit card once you make that reservation, and nobody's ever questioned it. I think that what you're seeing is, like what Mike was talking about, is as the trends change, you're going to see less pushback in that area. And I want to get back a little bit to when you're talking about credit cards. So I went into private practice in 1985 and accepted all 4 major credit cards immediately. So most dentists have been taking credit cards at least since the early 80s, if not the late 70s, as part of their practice. What the difference is between dental and medical is that medical, because of the federal laws that were put in place before Obamacare, forcing medical practices to computerize, then they developed their own medical portal. The concept of a dental portal hasn't really come around yet as much because of what Mike said about the cost. So your solo dentists probably are a little reluctant to spend that kind of money on software, but most of your dental software companies now have packages that you can add on that you can do all of the things that Mike was talking about. And the large dental vendors, I would say 4 or 5 dental software companies control almost 80% of the software market. That's not that much different in a medical side either. Is there anything else to that question you'd like for me to cover?
No, I think you covered it pretty well. And sort of what you said is like patients increasingly will just be comfortable with it because they've gotten so comfortable with it in so many other areas that it's likely where it's going, and not to be, as a dental practice, not to be bashful about asking for the card on file to make payment easier, knowing that it really is the recipe in a lot of the rest of the world. Let me ask each of you one final question, and then we've got a couple moments for questions from the audience. The next question, and Mike, let me start with you. What does the future hold for dental practices in the age of consumerism? What do you sort of, you have a crystal ball, what do you see out the next 5 to 10 years in terms of consumerism? And then, Richard, I'll ask you the same question. Dr. Hewitt.
Yeah, and Scott, you hit on it in your previous question, and we hit on it in some of the previous answers. It's how do we create that consumerism effect for dental practices? How do we, and again, they've been taking credit card for a very long time, but how do we get them to do text to pay? How do we get them to create card on file? How do we get them to almost eliminate paper in a dental office? Again, these were all mandated by the federal government for healthcare, but now dental over the next few years has a chance to catch up. And how do we leverage these consumer type technologies? And again, it's easy for all of us to sort of say to a dental practice, you should do these 10 wonderful things: card on file, text to pay, recurring payment, text. We could go on and on. Online web payments. We could go on and on with all these features. But as a dental practice, really, I think the future holds. You should dip your toes in some of these things and see what works for your office and see what you can do to really engage your patients. Again, if you're an office that has a lot of millennials, you're probably going to do really well with a card on file type feature. If you're an office that has a ton of high dollar payments, you're probably going to do really well with like a recurring or payment plan setup. If you're an office with a lot of patients like me, Generation X, I believe, you're probably going to do really well with online payment capability. So really over the next few years, dental practice really wants to dip its toes in those various things and leverage what works best for them. Not try to do it all at once, but spread it out over time to leverage those types of things, and it'll create a much better consumer/patient experience for your offices.
Thank you very, very much. And Dr. Hewitt, same thoughts from you. What do you see over the next 5 to 10 years in terms of consumerism?
You're definitely going to see a growing consolidation of practices where a solo dental practice is going to be the exception rather than a rule. And that's probably because of it in a rural setting where you don't need necessarily have a lot of dentists that are going to congregate together. But as you get more and more dentists to practice together, the features that Mike is talking about, you'll get the economies of scale that you need, that you'll be able to take all those items or possess all those items. The software can integrate. A lot of your major softwares now integrate with all those products. And the other thing that you're seeing, and one of the things I had a chance to work on in 2015 was the integration of the medical and the dental record for the Department of Defense. And that's something that you're going to see in the future, where you're going to be able to shoot electronically a consult over to an internist about one of your patients. And that's something that's going to require software and a different, mindset, a different paradigm for most dentists coming around. But as far as ease of payment, making it easier for all consumers to get, a lot of that is going to really come to fruition when dentists group together to cut down on costs in many, many ways, even not only in the front desk area, but obviously with equipment.
Thank you. And Mike, let me ask you this question from the audience. Texting a patient about their payment, to text a patient about their payment and be HIPAA compliant, do you need the patient's consent? Is that part of the consent they've got to sign that they're willing to take a text?
Yeah, you're complicating two different rules. There's a rule about texting people where you need consent for that. So the first rule, and that's the Consumer Protection Agency, says that in order to text a patient, you have to have their consent. So in order to text anyone, you have to have their consent. So the first text that you would engage a patient with is are you okay receiving text? And then the patient says yes. So that's not HIPAA, that's just consumer finance. The second one is when you do text a patient about payment, it's really not HIPAA sensitive data that comes over. It's more you owe X amount of dollars, click here to make a payment. And when they click there to make a payment, and they are brought to a portal, that portal is secure and able to accept HIPAA sensitive information. So the HIPAA data is not shared over a text message. The patient would also be required before they enter that portal to make the payment to validate who they are, whether they type in their date of birth or whether they type in maybe their account number. They would have to validate themselves in one way or another just to prove that they're there. So there's two sort of compliance agencies that have to be complied with, and the texting solution connected to the portal solution with the authorization to send a text adheres to all that.
Thank you very, very much. Great answer. Very helpful. Thank you. I want to now conclude. Mike Peluso, where can people learn more about Rectangle Health if they want to learn more about Rectangle Health?
Sure, absolutely. We have a website, rectanglehealth.com. You can check that out. We're also on LinkedIn as well. where you could contact one of our representatives directly through there. And if my contact information is sent out as part of the presentation, which I think it is, I'd be more than happy to talk to anyone that attended this session personally.
Thank you very, very much. And Dr. Hewitt, you're in the consulting world as well, in addition to being a dentist by background, or still a dentist, always a dentist. Dr. Hewitt, how do people learn more about Beachside Dental Consultants?
Okay, so the website is militarydentist.com, and you can simply email me, and it's on the website. You can email me at drhewitt@militarydentist.com. All the list of services, and I work with professionals like Mike in all other fields, and we try to integrate all types of services, and including accounting, financial, strategic planning, and any business types of advice that you would need. I work with most of the vendors.
I want to thank both of you for joining us today. This is brought to you by Becker's Healthcare and Rectangle Health. Thrilled to have this discussion today, Mike and Richard. What a pleasure to visit with you. Our audience, we thank you so much for providing a whole number of questions. We appreciate you joining us very, very much. We'll sign off now. Thank you, folks,
Thank you,
very
Scott.
much.
Thank you.
Thank you, Scott.